CAR T-cell therapy, now made in India, indigenously developed here, is in fact benefiting patients. There are several patients who have in fact undergone treatment, and some of them have been completely out of cancer. They've enjoyed cancer remission for a couple of months now. For doctors to confidently say that people are getting cured of cancer. The most beautiful and important aspect of this is that the cost has come down from 5 crore rupees to about 40 to 50 lakh rupees for our very own made in India CAR T-cell therapy. Take a look.
9-year-old Ishwari Bagirav from Nasik was diagnosed with acute lymphocytic leukemia, a type of cancer of blood and bone marrow. Despite undergoing several rounds of painful chemotherapies at Tata Memorial Centre in Mumbai, the cancer kept coming back. She is one of the first recipients in pediatric trial for CAR T-cell therapy clinical trial, which was conducted by Dr. Gaurav Narula in Tata Memorial Centre in Mumbai. Miraculously, in the initial phase of the trial, Ishwari was declared cancer-free, defying the odds. CAR T-cell therapy is promising hope in children like it is in adults. It is already used in India. 15 patients have undergone CAR T-cell therapy, and in at least 3 patients, there have been complete cancer remission.
Even in the phase 1 trials, we found not only that it was very safe, we found very good responses, that it was working very well. So after that, 2 phase 2 studies were launched. One in children and the second one in adults. So the adult study was sponsored by ImmunoAct, and the adult study is completed, and based on those results, the drug regulator has approved the drug for marketing in patients above 15 years of age. Pediatric trials are still enrolling, and we are seeing equally great results, if not even better actually, for leukemia.
My name is Vikas Jain.
Vikas in 2017 was diagnosed with multiple myeloma, a type of blood cancer which is categorized as incurable. He went through multiple stem cell therapies and chemotherapy over last 6 years, and 3 months ago he was treated with CAR T-cell therapy, and he has been cancer-free since.
I've had good results with the CAR T therapy in this disease. So far the disease is in remission, and I'm perfectly healthy and enjoying my life. The biggest benefit of the CAR T therapy is the fact that there is no medication that you need to take after you have done the CAR T therapy. So it's a drug that you take once, and once you get the drug, you don't need to take any maintenance therapy, any chemotherapy, etc.
This therapy is now available in over 30 hospitals in more than 10 cities in India.
Then 20-30% patients, the disease keeps coming back or doesn't go away. Then what to do? Then they need a transplant. Some of them can't even go for the transplant, or if they go for the transplant, it comes back. Then what to do? Then there is nothing left. In this situation, these therapies produced dramatic responses. So that is what CAR T-cell therapy is about, using the body's own T-cells, genetically modifying them outside the body, and then giving them back to the patient. But now they are enhanced, and they can now recognize the cancer and eliminate it.
The approval was backed by 2 small clinical trials in 64 people with advanced lymphoma or leukemia, presented at American Society of Hematology, with cancer disappearing completely in about half of them in the results.
This has come to as a boom and a savior for those people who had exhausted all their medications known to the mankind. Acute lymphoblastic leukemia or multiple myeloma, as such, there is no cure for a disease called multiple myeloma. The CAR T-cell has a new arm against cancers.
There are no major side effects related to the therapy. Yes, a patient needs a few weeks of hospitalization for the complete therapy. But the case study stands testimony to the fact that medical science is evolving to the extent to cure the disease, to make a patient cancer-free. With video journalist Manish Jha, Nitika Gandhi for India Today.